The problem of teen pregnancy, its causes and effects. Introduction. The problem of teenage pregnancy and childbirth is still present all over the world. Today, all over the globe, more than 15 million teenagers give birth, and 5 more are forced to resort to pregnancy interruption. In this regard, there is a necessity to study and judge such phenomena as teen pregnancy. The known fact is that for the overwhelming majority of teenagers, physical development advances the mental, and this difference makes 6, and in some cases 10 years. As a result, some problems are marked by many researchers. They are connected with the occurrence of unplanned pregnancies, abortions at an early age, left children, suicidal thoughts, and actions of the teenagers themselves. This paper analyzes the problem of teenage pregnancy as a consequence of causes and effects to demonstrate the dimensions of such phenomenon. Analysis. Possible causes for teen pregnancy can be listed as a junction of many factors. Based on child review, the factors can be identified as early school failure, early behavior problems, family dysfunction, and poverty. The connection of these factors with teen pregnancy can be described as female teenagers who experienced none of these risk factors had the lowest rate of pregnancy. The more risk factors faced by the teenager, the higher the likelihood of the teenager becoming pregnant and giving birth. It should be noted that within a single country, these factors can reach a larger influence within certain ethnic groups and nationalities as a result of higher prevailing socioeconomic factors, where the researchers have sought to establish links between teen childbearing and socioeconomic disadvantage. The outcomes of this phenomenon have also been a subject of thorough study, where they could be divided between social and medical effects. One of the outcomes of teen pregnancy could be considered the economic factor, when early marriage and early childbearing result in negative economic consequences. Some factors as completion of school and income were linked with teen pregnancy in earlier studies. However, the fact that the studied groups were mostly experiencing these factors even before the pregnancy was argued later in other works. When outlining the medical aspects of the outcomes of teen pregnancy, first of all, pregnancy creates an especially high risk for health. When they are younger, it is especially considerable for 13 to 16-year-olds. In particular, children born by women of this age group have low weight at birth and almost twice more often die in infancy than children of 20 to 30 years old women. Besides, teen pregnancy is accompanied by a higher frequency of clinical complications, including abortion, toxicosis, and bleeding, and also the raised level of mother's death rate in comparison with women aged from 20 to 30 years. It also should be noted that these factors are mostly associated with the aforementioned social layer, in which these medical outcomes are added to the difficulty of getting professional medical assistance. Conclusion. Despite the decrease in the number of birth rates by adolescents since the 90s of the previous century, the U.S. still peaks these statistics among the well-developed countries. This is an indication that more efforts should be put into the educational aspect to prove, especially for teenagers from low-income families, that pregnancy is not a way to succeed in life if failed in school or a way to take the role of an adult, but it rather more than that, as it is a long-term decision that can affect the future life.